At first, it looked like the flu: fever, muscle pain, exhaustion. But within days, his lungs began filling with fluid. Doctors were struggling to find out what was killing an otherwise healthy man. The answer may have been hiding somewhere unexpected, inside microscopic particles left behind by rodents, a group of viruses known as hantaviruses. In the Americas, a certain type of hantavirus can cause hantavirus pulmonary syndrome, or HPS, a rare but highly dangerous disease that attacks the lungs. And recently, growing attention around cases linked to cruise ship exposure has raised new public concern. Most hantaviruses spread from rodents to humans. Infections usually occur when people inhale airborne particles contaminated with rodent urine, saliva, or droppings. Activities such as cleaning rodent contaminated area, especially dry sweeping and vacuuming, can disperse infectious particles into the air. Less commonly, infection may occur through contaminated food or by touching contaminated surfaces or by rodent bites. However, one strain known as Andes virus has been associated with a limited human-to-human transmission in documented cases in South America. For days, sometimes even weeks, nothing seems unusual. Then the first symptoms appear: fever, deep fatigue, muscle aches. At this stage, HPS can look almost indistinguishable from many other illnesses. Some patients also develop headache, nausea, dizziness, or abdominal pain. And because the symptoms are so unspecific, the disease may not be recognized immediately. Several days later, the illness can take a far more serious turn. Patients may begin cough and develop shortness of breath as fluid starts accumulating in the lungs. As breathing becomes more difficult, many patients require hospitalization and intensive medical support. Doctors may suspect hantavirus infection when severe respiratory illness appears alongside possible rodent exposure. PCR and antibody testing can then help confirm the diagnosis. HPS is rare, with only a few hundred cases recorded each year in the United States. However, in documented cases, the fatality rate has been around 20 to 40%. There is no specific antiviral treatment or approved vaccine for HPS. Care is entirely supportive, focusing on maintaining breathing and circulation. Patients with severe disease often require intensive care, including mechanical ventilation. Preventing hantavirus infection mainly depends on one simple principle: reducing contact with rodents and environments they contaminate. This begins with keeping living and working space clean and making sure rodents cannot easily enter buildings. Sealing small openings in walls, floors, and foundation can significantly reduce exposure. Food should always be stored securely so it does not attract rodents indoors. When cleaning areas that may be contaminated, the method matters. Dry sweeping or vacuuming can release particles into the air and should be avoided. Instead, surfaces should be dampened before cleaning to reduce airborne contamination. Simple hygiene practices like thorough hand washing after cleaning or handling potentially contaminated materials are also important. But in 2026, an unusual situation drew attention from clinicians across multiple countries. On April 27, 2026, a passenger from the cruise ship MV Hondias was medically evacuated due to severe respiratory infection. He had developed fever and shortness of breath days early and rapidly deteriorated despite hospital admission. Shortly after, similar severe cases, including fatalities, were reported among passengers associated with the cruise ship. On May 2nd, international specialists linked the cluster to a single outbreak investigation. Laboratory testing later confirmed infection with hantavirus. Genetic sequencing identified Andes virus in confirmed cases. In total, 147 people were on board the vessel, including passengers and crew from multiple countries. By mid-May, 10 cases had been identified, including 3 deaths. However, not all individuals were tested, and further analysis is still needed to determine whether there was a single spillover event or limited human-to-human transmission. Hantaviruses are not new viruses, and scientists have known about them for decades. One type, called virus, can sometimes spread from person to person, but usually only after close and prolonged contact. It doesn't spread easily like highly contagious respiratory viruses. Right now, health organizations still consider the overall risk of the public to be low. So this is something to take seriously, but not something to panic about. Most hantavirus infections remain preventable through simple but essential public health measures, especially by reducing exposure to rodents and contaminated environments. Stay informed, see CDC and WHO links below for more information. If you found this useful, like and subscribe for more medical insights.